Thank you for joining Continuous Learning with Bioguard. It is my pleasure to introduce our webinar speaker, Dr. Sushant Sadotra. Dr. Sushant obtained his PhD from National Tsinghua University and Academia Sinica, Taiwan. He has expertise in biomarker discovery and protein structural biology, with a strong research background in investigating potential biomarkers for target diseases. Currently, Dr. Sushant works as a diagnostic product specialist with Bioguard Corporation. Speaking of feline infectious peritonitis, or FIP for short, FIP is a severe, often fatal disease in cats caused by a mutated Feline Coronavirus. While the original virus is typically harmless, the mutated virus triggers widespread inflammation, leading to either the fluid-filled wet form or the organ-damaging dry form FIP. This talk will explore the critical process of diagnosing FIP right in the clinic, discover how veterinarians are equipped to identify this deadly disease in cats, enabling timely, targeted care for affected cats. Without further ado, let's welcome Dr. Sushant.
Hello, everyone, and thank you, Dr. Robert, for your kind introduction. So I welcome you all to today's webinar. So before we begin, let me share my screen first. Okay, so Dr. Robert, is it visible to you, the screen?
Yes.
Okay, so I welcome you all. I can see many people have already joined. So let's start our talk. So today we will be discussing about the diagnostics of feline infectious peritonitis and some of the challenges that usually normal in-clinic diagnostics face for during their diagnostic journey of FIP. However, before we jump into diagnostics, we should first understand what is this disease about and how does it start and what is the right time to begin the diagnostics or to understand how should we begin with the diagnostics in the clinic. So as the name suggests, peritonitis, this infectious starts with the usually peritonitis means the redness or the inflammation of the abdominal area. So by this, the name also comes for feline, which is cat. Based on the symptoms or the initial clinical signs that occurred for this disease, it was named as feline infectious peritonitis. However, it's not just the inflammation or redness in the abdominal area in the cat, but basically in feline, it's a fluidic accumulation in the abdominal area when it is wet form of the disease, or it's an inflammation in the organs, which can be in lungs, kidney, or brain, which is a dry form of FIP. So we will discuss everything in detail later. But as we know that the progenesis or the prevalence of this disease is present worldwide, especially in young kittens and immunosuppressed cats. And basically, the key challenge is always the diagnostics, because the basic challenge is that it's always overlaps with clinical signs of other disease. So that's why using the correct diagnostic tool is very important at certain time interval when the cat is infected with FIP. However, FIP is not a virus that exists in nature. It's actually FCoV. So feline coronavirus is actually responsible for the development of feline infectious peritonitis virus. However, how does it happen is in the very beginning of the infection of FCoV in cat. So basically, feline coronavirus is a RNA genome virus. So when it enters into cat's body, it usually enters or gets stick to the abdominal area in small intestines. But there, the rate of infection of FCoV can be surpassed by the immune system of the cat and can be defended easily. However, it can still enter into the body of the cat, which goes through the lymphatic system, and later on, still it can be eradicated by the immune system or the formation of antibodies by the cat's body. However, sometimes in 10% of the cases, there is a mutation occurs in FCoV, which then begin to form FIPV. So how does it exactly happen that, as I mentioned, that in approximately 10% of the cats infected with feline coronavirus, which is the feline enteric coronavirus, when it's in the infection site, get some mutations that can change the virus behavior. Okay, so this kind of alteration allows the virus to enter into white blood cells, especially in the monocytes as well as macrophages. Yes, so which then tend to spread the virus throughout the body of the cat. So when this kind of situation happens, the virus is referred to as FIPV, which is Feline Infectious Peritonitis virus. So that's why the name changes, because of the mutations that are occurring in the feline coronavirus. So, yeah. So the mutations usually occurs in the spike proteins, which are actually the membrane proteins of the virus, which helps in the attachment of the virus with the host body or the cells in the host. And these kind of mutations, which are identified, occurs in 2 of the amino acids in the genomic in the gene of the virus. So basically, this research, which was published in 2012, reveals that in wet form as well as in dry form, M105 1058, when it mutated into lysine, then this kind of mutation was mainly found in the FIPV. Okay, when the FCoV changes into FIPV, as well as the second mutation, which was also observed, was S1060 into A. In 5 of the cats, it was identified in the wet form and 1 in the dry form. As well as there were certain mutations which were not identified yet. So as I say that in all, in this case, these 2 mutations are the most prevalent mutations that occurs in FCoV, responsible for it to become FIPV. And this gene, where the mutation occurs and change in the structure of the spikes, that changes the behavior of the virus as well, make it more defensive against the immune system, and which can enters and cut a lot of barriers in the cat's body. So when we talk about the initial stage of the FIPV, it always begins with the infection of FCoV in the enteric form. So FCeV actually affects the Cas. And when the mutation occurs in this gene, then it becomes FIPV, which then affects the white blood cells, including monocytes and macrophages, and cause the systematic spread. And as well as it drives a lot of immune-mediated responses in the body, resulted in the pathogenesis. Okay, so while the infection of FIPV occurring in the body, FIPV can cause infection in various forms. One form is clinical form that is known as effusive, which is known as a wet form as well, where the fluid get accumulation in the abdominal area of the cat. And there is another form which is non-effusive as well, which is known as dry form, where the granular mass is developed in the organs of the cat body. Okay, and sometimes in very severe cases, it can be mixed as well, where both effusive and non-effusive form of FIP is present in the cat's body. Okay, so now how this effusive and non-effusive can be differentiated? It's actually started as well as in the initial stage of the FIPV invasions. So when FIPV is already mutated in the cat's body, then virus through the bloodstream reaches brain as well as eye, where it starts infecting the monocytes. Okay, so the monocytes present, which are present in the blood, try to cut the barrier, which is known as blood-brain barrier. Okay, and when these immune cells have difficulty, reaching the brain, at that point, the virus is able to cut this barrier and enter into brain as well as in the eye. So if this protective immunity is strong enough, so virus particles or virus infected cells are quickly eradicated, okay, then there will be no problem. However, if this immunity is weak, then of course the immune cells are much more effective in dealing with the virus particles and the virus infected cells in the core of the body. And then it will be the brain or the eye, it will enter due to the blood-brain barrier, which is already shut down. So this causes lesions in the blood and eye also last longer than those in the abdominal area or other parts of the body as well, which then, it's the reason why this kind of FIP invasion actually known as dry form. Okay, so dry form usually starts occurring in the organs, especially in brain and eye, and then it can enters into other organs as well. So the basic signs of clinical signs or clinical symptoms of FIP is always like lethargy, and there will be a fever, there will be a certain weight loss in the cat, and and if it's happened in the young cats, especially kittens, there will be a poor growth of the kittens. So of course, you may know that these kind of signs are very common, in a lot of diseases. So, but still there are certain advanced clinical signs as well, which if a vet observe in the cat can, predict or assume that it could be an FIP case, which can be a fusion which starts with the pleural fluid kind of feeling in the abdominal area, or if we observe the eye, the ocular, there will be a change in the view of the eye. Either there is a redness or there is some yellowish color. Okay. Other than that, there will be a neurological symptoms as well, which can also be other sign that it could be a FIP case, combining the ocular changes as well as effluviation. However, if we talk about, since we mentioned that FIP is of two kinds, right? So based on those, the symptoms can be specific as well. For example, in the dry form, the eye symptoms will be more prevalent, right? And the neurological symptoms as well are more frequently observed. However, in the wet form, the ascites, which is inflammation of the abdominal area, as well as pleural effusion, the liquid formation, are more frequent. Okay, so yeah, these kind of symptoms, so either together or separately, if a vet observes in initial examination of a cat or a patient, cat patient, it can be predicted as a FIP. However, of course, the diagnostics is really important to really confirm whether it's other infection or other kind of problem in the cat, or really it's a FIP case. So, of course, the basic diagnostic starts with the CPV and biochemistry. After that, as I mentioned, that based on the symptoms, imaging can also be done and fluid analysis can also be done. Okay, so when we talk about the biochemistry, there are certain parameters that can be more specific related to FIP, which are especially the protein levels as well as albumin and globulin ratio. So if it is observed that it is less than 0.4, then it can be suggestive as a case of FIP, because the normal level is, less than 0.8, not less than 0.4. However, other than this, combined results of a bilirubin level can also be a sign of FIP, or the liver enzymes, if they are evaluated in the biochemistry test, then it can also be predicted or assumed as a FIP case. So if there are observations in the inflammation in the abdominal area, then of course imaging is another way that can be opt or picked to check whether it's a FIP symptoms or not, or FIP signs, starting with ultrasonography or radiography can be done. So suppose in the abdominal area there is a lot of fluid accumulated, which cause the abdominal look inflamed, then it can be clearly observed in the image in radiography. So other than ultrasound is also could be done, that can also show the ascites that is occurring inside the body. Sometimes vets also, what they do, if they observe the fluid, they take out some fluid and again check whether the area where they observe the fluid they can see the organs or not, because those image are is not clearly observed the organs inside the body when the radiography is done. However, when the fluid is taken out of the body, then you can still see some of the organs which can give a clear sign of FIP detection. So of course, if there is a fluid formation in the FIP, a very unique test known as Rivalta test is being conducted in clinic, which is very easy to perform, where the fluid that is collected from the pleural or abdominal area can be used as a detection for the FIP. So this kind of fluid is actually very clear or viscous or sticky, but it's a yellow color fluid. Okay, for example, at Bioguard, we have developed FIP detection kit, which is actually a Rivalta test, which is very easy to perform. So once you collected the fluid, you can mix it with the detection dye and then load the fluid into the third bottle, okay, which has some solution or buffer inside. So when this liquid is dropped in this buffer, it has a certain pattern that it will form that will be very clearly observed as a a sign of FIP. So as you can see in the picture that if it's a straight line formed from the drop where we drop from the surface till the end, a straight line, uncut line is formed, then it's a strong positive case. However, if the liquids start mixing in the buffer, then of course it's a negative. And if there are multiple lines formed, then it still can be unpredicted. Need to do some further testing. Okay. So as mentioned that you can see in the right hand side how the results will look like in a positive case where the drop from the surface till the end will form a very clear straight line. Okay. And because of the dye, it is very much visible. Okay. So what does Rivalta test actually helps with? So Rivalta test, if it comes out to be a positive test, basically it can tell you that either it's a FIP or it can be a lymphoma or bacterial peritonitis. Okay. However, it rule out the case of lymphoma and bacterial infection by 73.4% is because Rivalta test is very specific for the detection of FIP. However, if it's negative, then it's FIP unlikely. Okay, then it's another thing that this kind of liquid formation or the abdominal inflammation could be because of other diseases or other problems in the cat. Okay, so Rivalta test negative, but however the symptoms are still there, can be sign that you need to do further testing for other infectious diseases. However, if it's positive, you can further do some other tests in clinic that are there, such as feline antigen detection by immunostaining or through a rapid test, where a serum IgG can be detected as well using a FCoV AB titers. Okay. Other than that, you can also perform in clinic RT-PCR, but this kind of PCR is a reverse transcriptase polymerase chain reaction. Okay, since I mentioned in the beginning that FCoV is a RNA virus, it's not a DNA virus. So this kind of PCR is a reverse transcriptase PCR that has to be make sure that the PCR methodology that is adopted do have a reverse transcriptase enzyme that can convert RNA into DNA first and then can do the PCR normally, whether it's a real-time PCR or a conventional PCR, that's fine. However, it's what has to make sure that it's a reverse transcriptase polymerase chain reaction. Okay. So as I said, Bioguard, we do have developed all these tests, starting with the antigen and antibody test in the form of lateral flow immuno test, as well as PCR test for FCoV detection. But however, as I say that feline FIP is a very specific disease that is further could be identified also through the reference lab when the results are not very easy to diagnose through these kind of available in clinic test. Okay. However, if we go into detail of each test for the two forms of FIP, which are effusive and non-effusive, we can still use these in clinic tests. For example, in case of effusive FIP diagnostics, of course, there are certain symptoms which are common, but there are some symptoms which are specific for effusive form of FIP. So once this is identified that it could be an effusive form, the effusion or the liquid examination has to be done, right? So after taking the history and the clinical sign into account, and of course the symptoms that are more specific for an effusive FIP, the examination can be done through testing the A is to G ratio, as well as the protein levels and Rivalta test. Okay, so if the Rivalta test is positive and A is to G ratio is less than 0.4, then of course there is a chance that is a FIP. Okay, which that you can take this fluid to do the RT-PCR. Okay, and if RT-PCR turns out to be negative, then of course it's not FIP. The liquid formation could be because of some other reasons as well. So same goes with the other test as well. If the Rivalta test as well as FCoV antibody rapid test turns out to be negative, it could be because of some other infection in the cat, not the FIP. However, all these tests, if it turns out to be positive, ending with the PCR test, then it's a straightforward FIP case. Okay. So now, if we talk about the non-effusive form, which is the dry form, which is actually more tricky to do in clinic testing. However, still the initial procedure will be the same, that after checking the basic history of the cat, where we can check, a vet can check whether it's previously identified as FCoV infected or not, or often, the non-effusive form is diagnosed in under 2 years old cats. So once these kind of clinical signs combining with the history is taken into account, then we can do further testing using the blood test, first of all, where we can check the A by G ratio, the other proteins such as globulin and bilirubin can be checked, which I say that if they are evaluated levels found in the report, then it's likely to be FIP case. Other than that, if it's we can also check if there is a sign of anemia or lymphocytes, because as I say that FIP has entered into various ways through lymphatic system or through the bloodstream, where these kind of diseases can also be occurring. So having these kind of clarifications can also combined with the other parameters that we discuss about the different protein parameters, possibility to be a FIP infected. Okay, after this is confirmed, then the FCoV AB antibody test can be performed. And of course, in the bloodstream, if antibodies are there, which are present but not able to fight for this kind of mutated FCoV, but the positive FCoV FCoV AB test is still a sign of FIP infection. Okay. However, instead of doing PCR of the blood, which is not workable in this case, we have to do PCR through a biopsy of the infected organ. Okay, so basically wherever the infection site is observed, we have to take the biopsy sample or the aqueous humor sample for the RT-PCR. Okay, and if this sample turns out to be positive, then it's a non-effusive or the dry form of FIP, which is a very good confirmation. Okay. Other than that, for the dry form of FIP, confirmation is also through another parameter of the protein, which is alpha-1 acid glycoprotein. Okay, so this test, of course, can be performed with the help of reference lab, where this protein parameter, if it's greater than 1.5 gram per liter, can be also clear confirmation of dry form of or non-effusive FIP. Okay. However, if it's normal, then it's not again the FIP case. So maybe the sample collected is not from the right area or the target organ that is infected by FIP. Okay, so taking sample in non-effusive or dry form FIP is very important to be considered. Okay, so because of these reasons, there are certain limitations in in-clinic testing of FIP, especially when we talk about the supportive method, such as complete blood count or the chemistry panels. So these are always the supportive method, but it can be a certain cannot give you a certain validity of the infection of FIP. And when we talk about the FCoV antibody titers, that can also indicate that there could be FCoV, FCoV exposure, which is probably converted into FIP, but still it cannot differentiate between FCoV and mutated FIP. Okay, so and when we talk about the another last method, which usually a clinic or pick is PCR testing. So in this, it of course can detect virus if the RT-PCR performed, not the normal PCR, of course, but it still cannot confirm whether the virus is mutated or not. Okay, so there is still a risk of false positive or false negative cases through PCR methods. But here I'm not talking about advanced PCR methods, because advanced PCR methods can always be more specific for FIP detection. Okay, so when we talk about the advanced methods, which are more detailed molecular diagnostics, often performed by reference lab or more, advanced clinics or hospitals that has these facilities where they can do PCR directly of the FCoV mutations. Okay, so these PCR, RT-PCR can identify the mutations that usually the spike gene mutations, which we previously discussed. Okay, but there is a limitation that it could be not 100% sensitive. The false negative results are still simple based on the low viral load. Okay, so which we also see many times in our reference lab, because at Bioguard we have our own reference lab where VET informed us that the case was very much likely to be FIP. However, the PCR turns out to be negative. It's because the sample at the point when it was collected and sent to the reference lab, the viral load was very low, which was not in the range of detection. Okay, so if it's a quantitative one, of course, the CT value will show you that. Okay, or it won't be seen. The CT value won't be and have any value because of this reason. Other than PCR, histopathology testing is also being done, where inflammation around vessels or organs can be confirmed. Okay, but it requires HIC to confirm, FCoV. So again, it's a very tedious job, cannot be performed in clinic. Only a reference lab can do it, and also not very cost effective. However, when it says, when we talk about HIC, which is an histochemistry, which can, combined with histopathology, can detect the presence of virus in the tissues, macrophages. Okay. However, it requires biopsy. Okay, because in the dry form of FIP, of course, a proper organ, infected organ has to be selected first, where the biopsy has to be done. Which is also very intensive process. Sorry. And lastly is about the immunofluorescence on the effusion cells. where again the virus in the form of FCoV antigen can be detected in macrophages. This test can be very specific, but not all reference lab offers this test. So that's why, as I say, that all these advanced tests also are not, very much familiar or used by the vets directly. Either the reference lab can offer them, or they can find out whether around them these tests are possibly to be done or not. So uh, so talking about the challenges that a vet clinic usually faces while the diagnostic processing of FIP is, of course, starting with the initial stage, where all the non-clinical signs are sometimes overlap with other diseases occurring in cat at the same time. So these kind of non-specific clinical signs in the early stage can be very confusing for a vet to diagnose FIP. Especially when we talk about the wet form and the dry form, they are present completely in a different scenario or a different situation or different kind of symptoms that can give in the early stage. Okay. So other than that, this kind of overlapping can also be because it can mimic the other cause of inflammation or the fluid formation in the cat's body. As we discussed that if the Rivalta test and the other kind of test where we test these kind of pleural effusion from the cat's body, but the test turns out to be negative. It could be because of lymphoma, it could be because of a liver disease or bacterial peritonitis instead of viral peritonitis. Okay, so that's why I say that the overlapping of the symptoms can occur even the initial symptom looks so much close to FIP, as well as for neurological signs and ocular signs as well, which may resemble that they are dry form of FIP, but it could be also because of other infections as well, not just FIP. Okay. So still, if the patient arrives at vet clinic, then when should we diagnose for FIP? Of course, as early as possible, so that after we confirm through all the available tests that are there in clinic or through reference lab, it's important because uh, early detection can help in the recovery of the patient. Yeah. So early suspicion can target, and very the thing that needs to be considered here is about that early suspicion have to be to the targeted sample. If the sample is collected from a wrong site, of course, it will give you a negative FIP results, which can surpass the diagnostics that have been chosen for that particular sampling. So as I say, the effusion analysis is more ideal because it's like if the liquid sample taken from pleural effusion or wherever is it, the liquid is identified, sorry, turns out to be positive, then it's very easy to detect FIP. However, in dry form of FIP, it's more tricky to do that. So targeted sample for FIP detection is very important. So, however, if suppose still there is a delay in the diagnostics, so what will happen? So, of course, the projection of the disease will go into the advanced stage. Okay, so in the advanced stage, what happens that FIP start affecting different organs or different areas of the body. As I say that disease can be because it's circulating through bloodstreams, especially through macrophages and monocytes, right, which can enter through bloodstream into different organs. So which can cause multiple infections in the cat, as well as the FIP can be present in both forms then in the cat, both in the effusion form and non-effusion form. Okay. So at that point, if the antiviral therapies have been given to the cat, which will reduce or prolong the treatment process, and also it will increase the risk of misdiagnostics as well. So more delayed in the diagnosis, and or multiple infection site in the cat will be a more risk of fatal uh, situation in the cat. So progenesis and treatment implications, of course, has to be there in the early diagnostics. Allows with the antiviral that are given to the cat will stop the multiplication of the virus in the body. So this will give more chance for a cat to live longer with the FIP. However, if they, as I mentioned, there is a delay in the diagnostics, then it will be irreversible, whatever organ damage have been happened already in the cat. So at that point also, the supportive care will not be very effective in those kind of later stages in the cat, which will lead to the death at the end. So yeah, that have to be very careful. That's why diagnostics is again combined with upcoming advancements that are happening in veterinary diagnostics field, especially through next generation sequencing, where we know that the mutations are actually the cause of FIP symptoms or FIP related problems in the cat. So the next generation sequencing can target the mutations that are occurring in FCoV, which are related to FIP, which cause FCoV to become FIP. So it confirms those kind of mutation sites, and which can be really easy to diagnose after through PCR or through other methods, as well as rapid point of care molecular assays are also there that are day by day getting easy to use or be in clinic can be performed. Other than that, the available serological or antigen detection tests, the sensitivity and specificity are keep improving day by day, so that the results that what we are getting from these kind of diagnostics can also be trusted or have reliability for the FIP detection, as well as, of course, this one we cannot ignore with the AI assistant, especially in the imaging section of diagnostics, as we know that imaging is already being advanced in recent years, but also AI has making it more and more user friendly, as well as bringing it back to the clinic, where we don't need a real analysis of whatever image we got. AI is assisting in the analysis or the prediction of the result interpretation, we can say that, which can also helps a vet to clearly identify whether it's a FIP related problem or it could be an other kind of infection. So that's why AI is also assisting a lot in the diagnostics, and of course this will improve in coming years. Yeah, but still, why real-time PCR is the most trusted method so far, or chosen, I would say, by the veterinary clinics. And of course, in our reference lab, and also our PCR product, which is Qmini, we have developed FCoV, and all our vets are using our PCR detection method for diagnosing FIP FIP is for a reason because of its high sensitivity and specificity. And of course, the reliability that it gives for the detection of FCoV in the correct sample collection during the FIP infection, or to confirm whether there was a FCoV infection in a previous, in the history of the cat. And then whether it could be because of that reason that the new symptoms of FIP have been developed because of the previous infection of FCoV. Other than that, as I said, what we also focus on is a quick diagnostics, right? So the quick diagnostics, of course, when we dependent on reference lab, it takes some time to get the results, but having an in-clinic PCR systems helps to get the results in hours rather than days, right? So this kind of facility or advantage of having an in-clinic PCR is another thing that is helpful in the early diagnostics to, also make the right decisions at the right time. So this kind of rapid identification helps prevent disease transmission as well as not in case of FCoV or FIP infection, but other cases as well, where other animals which are visiting clinic or have been put in the recovery section of the clinic can be prevented from the disease transmission based on their infection thing. And of course, the PCR, Qmini PCR especially, if we talk about, offers screening of multi-pathogens. Now, this is also very important that whether performing PCR just for one disease or with the same sample, you're performing multiple PCR, as I say, that the symptoms can be, mixed or can be confused with other infections as well. So rather than collecting sample again and again for doing screening of different pathogenesis, you can perform the same, collecting one sample and perform multiple pathogens using Qmini or the kits that have been developed in the system, which will also help to separate the confusion that are occurring because of the common symptoms because could have happened inside the cat. Okay. And of course, if some cat, mostly the pet cats are in-house, they don't like to go out, but there are still some cats which are very outgoing, can go outside and, interact with other animals as well, or the environment as well. So in those cats, it's always found that there are always a mixed infection. Some are in a hidden form, or some are, get mixed with other diseases that are occurring in the body. So as I say, screening of multiple pathogens at the same time, if there is some symptom present in the, available in the market, of course, it's very important to choose that for correct diagnostics. Yeah. So in summary, as we say that FIP diagnostic will always remain a challenge. It's because not that the diagnostics that are available currently are wrong or right. It's always because of the condition, the stage, the symptoms, the sample collection, or and so many other factors that we discussed today are there. And as well as the clinical signs could be vague or overlap with other diseases, So limitations of routine tests is also another thing that most of the pet owners don't do routine tests for their, for their cats. So sometimes FCoV can present as a hidden form, right? It doesn't have a very severe symptom. But inside the cat body, if this FCoV get mutated, and by the time there is no, it's too late to do the FIP. Even the FIP is diagnosed, but too late for the treatment or other thing, then the case become more problematic. So yeah, confirmation of before the death is very important for correct diagnostic of FIP as well as other diseases as well. So if we talk about the approach of FIP diagnostic, will be always a combination of clinical history as well as supportive tests and the advanced test based on molecular or antigen detection, which together offer the most reliable diagnostics in practice for FIP case. Yeah. So with that, I hope that this talk is very informative to all of you. And thank you so much for listening. And also, please, just to remind that if you have registered for the webinar, it's okay. You will receive a certificate for joining us today. Other than that, if you are just joined through the link, please leave your email address in the comment, and we will send you e-certificates later on. So thank you so much, and session is open for Q&A, and I will read some of the questions because in between our time limits. So let me go through all the questions. Okay, most of the people are requesting for presentation. Okay, sure, we will share this presentation after our seminar. Also, the YouTube, our YouTube channel will have this presentation uploaded in coming days. So you can please follow our YouTube channel for updates as well. Okay. Okay, there is one question. Can dry form of FIP increase its blood glucose level and subsequently ocular crystallization? Okay, so as I say that this kind of symptom is actually not related to dry form of FIP. Initially, it can be, a vet can get confused because of that, but dry form FIP does not directly cause an increase in the blood glucose level, okay, based on the eye symptom that you saw, the crystallization or other thing. So rather this kind of ocular sign of FIP, you should look for more of a anterior uveitis, or which can result, as we saw in the picture, that it's an underlying inflammation of the disease process, okay? So which can include the accumulation of fibers kind of thing, not the crystals, because FIP usually cause the protein, the protein to play a role in the body. Okay, so the inflammation and the inflammatory cells within the eye, not a change in the blood glucose level. Okay, yeah, thank you. Okay, let's go through the question. Okay, this one is again the same. So for the treatment, we didn't discuss treatment today. Probably in our next seminar, we will discuss about the treatment of FIP. So today we'll only take the questions related to diagnostics. Okay, so there is a question that from a vet student, okay, although they have 4 questions, but I'll address one of them. If a cat is diagnosed with wet FIP and having fluid in the abdominal, so should I withdraw 100% of those fluid at once, or just 50 to 80% of the fluid to that fluid? And is it at any risk of taking off 100% of that fluid? So as I say that, when you observe a fluid inside the body, for the detection of FIP, of course, you just need a little bit of sample. But for the sake of the protection of the cat's body, this decision have to be taken based on where the fluid is located, which organs it is around, okay, whether it's inside or it's leaking as well, because sometimes there are fluid that cross the barriers inside the body, the blood vessels are broken. So that's why it's very important to clearly identify the location as well as the organs around that fluid. So that's why taking off 100% of the fluid could not be done at the same time. Okay, it has to be done in intervals, and frequent scanning has to be done. How the inside system or the inside picture has to be known. Okay, yeah. Thank you. And okay, most of the people are asking for handouts. Yeah. Okay, this is again related to treatment. Okay, this is the last question, but the name is anonymous. So if the cat has fever, weight loss, and blood check has Ag level 0.6, can that cat got FIP? So I think for this one, as I say that if we talk about the examination that you are talking about, so Ag by A and is to G ratio has to be less than 0.4. Okay, so this is one sign. As I say that this is not the confirmatory test, but this is still very unique or close to FIP detection. But the other proteins or the other tests still have to be performed to really confirm, which could be, as I say, based on the understanding whether it's a effusion or non-effusion kind of infection. So have to be done through other tests as well, combination of all the tests. Okay, yeah. How can we treat dry form? Treatment next time. Okay. Variations in the sequence close to the characteristics mutation in FIP can cause any interference with the binding of the detection probe. Sorry, Francisco, could you please elaborate your question, or maybe you can write and we can answer you later, okay? Okay, yeah, I think there are so many comments, but most of the people, I think, would like to have the FIP, or they are mostly like to discuss the treatment, of course. So yeah, we will highlight or discuss the treatment in our upcoming webinars. And due to time restriction, I think we have to close the webinar for today. However, we will still address your questions that you have put, because I didn't go through all the questions today, as well as a lot of emails I can see you have given us. So thank you so much for joining today. I'm really glad that you take out time to listen to the talk, and you are most welcome to attend our upcoming webinar as well, which is next month by Dr. Robert itself. So thank you so much for joining today, and see you next time. Yeah, bye-bye.